Is tooth whitening bad for your teeth? That's a question that a lot of people ask, and a lot of patients do have that question at the back of their minds when they're considering having their teeth whitened. Let's look at some of the common side effects of tooth whitening, because every medical or dental procedure or anything involving a chemical will have certain side effects. Some of these side effects may be temporary, some of these can be permanent, and some of them can be fairly serious as well, and whilst most of them tend to be fairly minor. The most common side effect or problem that patients experience with tooth whitening is that of sensitivity. After or during you've had your teeth whitened, you can experience sensitivity, and the sensitivity might be fairly minor and very short-lived and really not troublesome at all. However, in certain patients the sensitivity can become very painful, almost to the point that they actually need to start taking painkillers, and they even have to stop the tooth whitening process altogether. The sensitivity in itself does not harm or damage the enamel of the tooth in any way, and the sensitivity, if left alone and the whitening stops, will just gradually disappear over a few days. It's quite rare to get sensitivity which goes on for more than a few days, and if that happens, it usually means that there may have been a filling which was leaking and therefore it has now been affected, or it can be that perhaps there was a cavity in your tooth which you didn't know about, and the gel has gone into the cavity and into the nerve, and hence aggravating the tooth. Once you do get sensitivity, it's best to apply some sensitive type of toothpaste directly onto the teeth and leave it there. This is best done in a number of ways. Firstly, you can simply brush your teeth or rub the sensitive toothpaste on the sensitive area and leave it there. It's best to do that at night, because you can just apply the paste and then leave that on without rinsing your mouth out, so it works, for a few hours during the night. Another more effective way to get rid of sensitivity is during the process of tooth whitening, especially home whitening. You'll have had some tooth whitening impressions and trays made. The tooth whitening process in itself asks you to put the tooth whitening gel into these trays, but you can use these trays to place the sensitive toothpaste into. In that way, the sensitive toothpaste is kept in contact with the surface of the enamel for quite a long or a more extended period of time than just rubbing it on, and therefore the sensitivity will be reduced a lot quicker. In addition, you can ask your dentist to give you a special desensitizing tube of a gel that also helps in getting rid of sensitivity. If the sensitivity is particularly bad, then your dentist may advise you to stop the tooth whitening process altogether, or to actually reduce the time that you do the tooth whitening. So if you carry out the home tooth whitening overnight, you may have to then use it during the daytime, but perhaps an hour a day. Even if 1 hour a day causes too much sensitivity, you might have to reduce the time period to half an hour a day. So you could use half an hour in the morning, half an hour in the evening. You just have to gauge what works for you. You don't really want to be using the home whitening gel for less than half an hour a day, because it really won't be that effective. Let's look at sensitivity on the gums. The tooth whitening gels are designed to be placed on enamel only, and it is fairly common to get a little bit of gel onto the gum. If some of the gel goes on the gum, you can simply wipe the gel away with a bit of cotton bud or a tissue. However, if the gel does go into contact with the gum for an extended period of time, this can then cause an ulcer on the gums. You will get pain on the gum if the gum has been affected in that way, and that means you need to take out the home whitening trace from your mouth and look at where the excess material has gone onto the gel and just clean it off, and then perhaps start again. If you get this problem on your gums constantly, it could mean that the tooth whitening trays that have been made are not really fitting as well as they should, and therefore you will need to go back to your dentist to have the trays checked, and if necessary to have some new trays made so you can carry on with the home whitening. If you do get an ulceration on your gums because the gel has gone on there, this will disappear by itself. However, if you use vitamin E oil, this does drastically make the healing a lot quicker. You can simply buy some vitamin E capsules from a health food store or a supermarket or a chemist, and the capsule of oil is pierced, and then the oil that comes out can be simply applied onto the area of ulceration that has been caused by the tooth whitening gel. A lot of patients are worried that they may swallow the gel and it may be harmful, or it may cause cancer and all sorts of horrible diseases. Fortunately, tooth whitening has been carried out for more than 20 years, and unless you swallow a huge amount of tooth whitening gel, for example a whole tube, then small amounts do not affect the body in any way. You do want to avoid swallowing the gel. However, a small amount will always work into your saliva and you will swallow it, but you don't need to worry about swallowing it. Another problem that can occur is when you are having tooth whitening done and you have fillings on those teeth which you are trying to whiten. Tooth whitening only works on tooth enamel, so if you have existing silver or white fillings, the colour of these will not be affected in any way. I've put this down as a side effect because once you've had your teeth whitened, those white fillings will no longer blend into your teeth as before, and they will stand out even more because the fillings will be a darker colour than the enamel, which has been whitened. However, before you have your whitening done, your dentist should have mentioned that your fillings may need changing because your silver or white fillings won't change their colour with the tooth whitening gels. A related problem can occur is if those fillings are leaking in any way before you have your tooth whitening done, and it can happen that when the gel goes onto the fillings, the gel can work its way into the filling, underneath the filling, and therefore this can cause problems. It is important to bear in mind that tooth whitening is not a permanent procedure. Sure enough, when you have your teeth whitened initially, your teeth will look absolutely white and sparkling, hopefully, but over a period of time, due to foods and drinks that stain your teeth, and also the whitening will eventually wane away. This means you should therefore have your teeth whitened again, or you need top-ups. I have mentioned this as a side effect so that you prepare to have further tooth whitening carried out in order to maintain their whiteness. Another problem with whitening can be where the whitening is uneven. So you have your tooth whitening done, and when the tooth whitening has been completed, you may notice that the white colour is slightly uneven. The two most common areas for this to occur are around the neck or gum line of the tooth and along the bottom edges or tip of the teeth. Usually it's not a problem, but it can mean that the middle of the tooth looks really white and the tip and the oar and the gum line looks a little bit darker. There isn't a huge amount that you can do if that happens, and the reason why this happens is due to the different thickness of enamel on the surface of a tooth. Enamel is thickest in the bulk or the middle of the tooth, and if you have teeth which are worn down along the edges, this means the enamel will be thinner, and as whitening gels only work on enamel, there is less enamel to whiten. This is the same case also at the gum line or the neck of the tooth, where the enamel can be thin or even non-existent. This is where tooth whitening needs to be monitored and prescribed by a dentist, ideally, so that the dentist is in a position to warn you of all these side effects and things that can go wrong. In conclusion, there are side effects of tooth whitening, and tooth whitening can be bad for you. However, nearly all of these circumstances can be predicted beforehand, and the best way to predict them is for a dentist to advise you and tell you which whether tooth whitening is suitable for you or not. Overall, many hundreds of thousands of tooth whitening procedures are carried out every year, and over 95% do not give rise to any problems. If problems, and when problems do occur in the other minority, they are nearly always temporary, and there is always something that you can do about it as well. Thank you.